Your body can cope with some reduced kidney function, so it can often maintain a balance for quite a while even if you have early-stage chronic kidney disease, CKD. Plus, even if you do have symptoms, they can be quite vague and you may link them with other things, rather than problems with your kidneys. At this stage, CKD is usually only likely to be picked up in routine tests for another condition. 10 symptoms of chronic kidney disease. Trust me, this video is very helpful in kidney disease. This video give information about its signs. These are all typical signs you might notice once your kidneys have some significant damage. But it's important to bear in mind they can all be symptoms of other conditions. Only your doctor can confirm CKD is causing them. Always make an appointment if you notice any of these symptoms. 1. Blood in your urine. This can be caused by lots of different things, but kidney disease is one of them. When your kidneys are working properly, they keep the blood cells in your body when they're filtering waste out of your blood. If the kidneys' filters are damaged, though, some blood cells can leak into your wee. If you see blood in your wee, you should always see your doctor urgently so they can rule out infections, plus more serious things such as cancer of the bladder and kidneys. 2. Puffy eyes, ankles and feet. Notice puffiness around your eyes and/or swollen ankles and feet? When your kidneys are not removing excess water and waste from your body, it can build up in your tissues. This leads to swelling, usually in your lower body, although it can affect other areas, including around your eyes and sometimes your hands. If untreated, it may progress to excess water in the lungs, causing shortness of breath. Doctors call this pulmonary edema. 3. Foamy wee. Froth in your wee is a sign there are high levels of protein in it, especially if you have to flush a few times to clear the bubbles. Hint: it may look like the foam you see on the surface when you're scrambling eggs, because the type of protein that ends up in urine is the same as the albumin found in eggs. 4. Tiredness and brain fog. When your kidney function dips, toxins build up in your blood, which can make you feel tired and struggle to concentrate. Also, CKD can cause anemia, a lack of red blood cells, which can cause tiredness too. 5. Poor appetite. A common symptom of everything from stress to a range of serious illnesses, poor appetite can happen in CKD because of a buildup of toxins. 6. Nausea. CKD can cause feelings of sickness because your kidneys are not removing toxins from your body properly. 7. Needing to wee more often. Healthy kidneys filter your blood and pass waste out in your urine. But when the kidneys are damaged, they may make wee that contains mostly water, with few waste products. That means you may end up needing to go to the toilet more often, especially at night. 8. Dry, itchy skin. Experts don't know exactly why kidney disease leads to very dry, itchy skin. But it may be connected to a few different factors, including toxins in the blood and an imbalance in levels of minerals in your body. 9. Muscle cramps. Occasional cramps are normal, but poor kidney function can cause more muscle cramping. 10. Sleep problems. There are a few reasons CKD can affect your sleep. Toxins can build up and circulate in your blood, which can keep you awake. Obesity is an underlying cause of both CKD and obstructive sleep apnea, which can cause you to wake very briefly lots of times through the night. And needing to go to the loo in the night can seriously disrupt your sleep. 11. Shortness of breath. 2 reasons contribute to the link between renal illness and experiencing shortness of breath, particularly after exertion. When the kidneys do not work correctly, excess fluid in the body flows into the lungs. 2. Anemia depletes your body's oxygen supply, resulting in shortness of breath. 12. Having back pain. Kidney failure can cause back discomfort, often deep and placed just below the rib cage. It is most commonly felt at the front of the groin or hip region. Kidney cysts, which are huge fluid-filled sacs produced on the kidneys due to polycystic kidney disease, can cause back and leg pain. 13. High blood pressure. Your circulatory system and kidneys are interdependent. Tiny nephrons in the kidneys filter waste and excess fluids from the circulation. When blood arteries are broken, the nephrons that filter your blood are deprived of oxygen and nutrients. As a result, hypertension is the second largest cause of kidney failure. 14. Changes in urination. Your kidneys are in charge of producing urine and excreting waste through it. You should not overlook urine changes in frequency, odor, color, and appearance. The following are examples of common sorts of changes. Increased urge to urinate, especially during the night. It is considered typical to pee 4 to 10 times each day. Detection of blood in the urine. Healthy kidneys filter waste from the blood to make urine, but if the filter becomes clogged, blood cells may begin to leak out into the urine. Having frothy or foamy urine. Bubbles in the urine, especially those that require you to flush multiple times before they disappear, suggest that there is an undesirable protein in the urine. 15. Experiencing bad breath and metallic taste. When waste accumulates in the blood, it alters food flavor and leaves a metallic aftertaste in the mouth. Another indicator of too many chemicals and pollution in the bloodstream is foul breath. Furthermore, you may lose your appetite and stop desiring meat, leading to undesirable weight reduction. 16. Concentration issue and weakness. As per a study conducted by Temple University, if you are witnessing any problems like decrease in global cognitive ability or have trouble memorizing something, it could be a sign of decreased kidney functioning. Decline in kidney function can lead to the buildup of toxins and impurities in the blood. This can make you feel tired, weak, and you may also find it difficult to concentrate. Even worse, kidney failure can also lead to toxin buildup in the brain and can cause major confusion. So it is best to consult a doctor. 17. Vomiting. Generally, earlier stages are known as 1 to 3. And as kidney disease progresses, you may notice the following symptoms: nausea and vomiting, muscle cramps, loss of appetite, swelling via feet and ankles, dry, itchy skin, shortness of breath, trouble sleeping, urinating either too much or too little. Hemodialysis patients are prone to gastrointestinal bleeding, and Mallory-Weiss syndrome, MWS, is one of the causes. Mallory-Weiss syndrome is often induced by severe vomiting, manifests as upper gastrointestinal bleeding, and is self-limited with a good prognosis. The bacterial infestation causes the kidney to become inflamed, producing symptoms like fever, chills, lower back, flank, pain, nausea, and/or vomiting. 19. Abnormal urine test. High amounts of protein in your urine, called proteinuria, can be a sign of kidney disease. Healthy kidneys filter out waste and fluid, letting protein return to the blood. When the kidneys don't function correctly, protein leaks into your urine. 20. Difficulty concentrating. Key points: brain fog, difficulty focusing or concentrating. Mental fatigue, feeling mentally exhausted quickly. Forgetfulness, unusual forgetfulness or memory lapses. Kidney problems can affect cognitive functions, impacting concentration and mental clarity. These hard nuggets grow when minerals, usually calcium, build up in your urinary tract. They can really hurt, especially in your back near your hips and ribs, if they get big enough to block all or some of your pee. You might see blood or even a piece of a stone in your urine. Remember that everyone's health is unique, and any concerns about your kidney health should be discussed with healthcare professionals. Regular health checkups and proactive measures will not only help your kidneys but also contribute to your overall well-being, allowing you to lead a healthier and more fulfilling life.